Come in.
Hi, Julio.
Hey.
It's nice to see you today.
Thank you, thank you.
I hear we're having some issues with your allergies.
Yes.
Is that correct?
Yes, it is.
Okay, I'm just going to have a quick look at your chart.
Okay.
So how long has this been going on for?
Past 2 weeks at least.
Okay, and are these symptoms you've had before, like maybe seasonal allergies, or is this altogether new for you?
I don't have seasonal allergies. This is a new thing for me. I just moved here from California, so I don't know if it's just allergies or my girlfriend's cats. I don't know.
Oh, wow, that is a very long move. Well, welcome to Pennsylvania.
Thank you.
Definitely allergies can be exacerbated by moves and different allergens in the area. We have different pollens and different trees that are in California, so that doesn't surprise me. Okay, very interesting. Were you allergic to, do you have any allergies to cats? Were you allergic to cats before this?
Nothing at all.
No, okay. So tell me a little bit about your symptoms specifically. What exactly have you been experiencing?
In the morning, I have dry eyes. During the day, I have runny eyes, sweat throat occasionally, and a little bit of a cough. My one hand, I have a little bit of a rash here, so that's about it.
Okay, what about any congestion? Are you experiencing congestion?
Definitely congested.
Okay. Got it, okay, congestion. And have you had any issues with like a broken nose or a deviated septum?
Yeah, an old childhood injury actually.
Okay, and what side was that on?
The left side.
Left side, deviated septum?
Yep.
Got it, okay. So that doesn't surprise me then. If you have an old injury, especially with a deviated septum, it can cause an occlusion on one side.
Okay.
So the new allergens in the area could be kind of exacerbating that issue. So that's definitely something that we'll look into.
Okay.
And as far as the coughing, is it something that gets better or worse if you do anything differently, like drinking hot or cold? Is it always persistent throughout the day? It kind of never changes?
Yeah, it's the same.
Stays the same. Okay. So it's pretty persistent. And let's talk about that rash. Are you noticing any itchiness or bumpiness?
Yeah, it's itchy. It was bumpy, but it's not bumpy anymore. But it's definitely itchy.
Okay, so the bumps kind of come and go, but the itchiness is persistent.
Right.
So let's get into some questions about your personal habits and routines, okay? Have you started using any new products recently, like a new body wash or a lotion?
No.
Laundry soap, dish soap?
No.
Everything's the same, okay? What about eating anything you've never tried before or anything you don't eat very frequently?
No, same.
No?
Same things.
Same, okay. And you said you don't really have any issues with seasonal allergies. What about any specific allergies? Are you allergic to any food or any? No? Very good, okay. Alright, Julio, so let's go ahead and get started with the exam. I'm going to just do a quick cleaning of my hands, and I'll ask that you do the same, and then we'll proceed from there, okay?
All right.
So I've just got some spray sanitizer here. Okay, and before we proceed with anything else, I am just going to do a quick nasal swab if that's okay.
Okay.
Where it is cold and flu season, we want to test for any viruses or any of the flu strains, so we'll go ahead and get that done, okay? Okay, so this is our nasal swab test. Let me just get everything out. We've got a couple different parts here. This is going to be the actual test, which I'll get to a little bit later. We have our nasal swab, and then we have the antigen liquid. So we're going to put this in there, and I'll give you the results. But for now, let me go ahead and get your swab.
Okay.
If I could just have you tilt your head a little bit. Okay, sorry about that. I know it's a little bit uncomfortable.
That's okay.
So if you'll give me about 2 minutes, I'll go ahead and get this tested and I'll be right back.
Okay, thank you.
Okay, Julio, the good news is that everything was negative, so we're all clear there. Lastly, before we get started with the allergy test, I just need to do a quick test of your sinuses. Is that okay?
That's fine.
Okay, so this is just going to be like a light once-over. I just want to make sure that we're not having too much swelling and inflammation. You might need to have a sinus massage. If you do, we'll address that, but if not, we can move forward, okay?
All right.
Okay, so I'm just kind of looking over here. Do you have any pain as I palpate here?
No.
Move down. Any pain here?
No.
And can you feel that equally on both sides?
Yes.
Feel it?
Yes.
Okay, and I'm just going to move your glasses for 1 second. Any pain here?
No.
Okay, and then lastly, are you having any pain here with your lymph nodes?
No.
Everything there feels normal?
Yes.
Okay, perfect. It looks like we can move forward. There is a little bit of swelling that I noticed, but it's nothing emergent. I think we can go ahead and move on with the allergy test, okay?
Yes.
Alright, Julio, so let's go ahead and get started on the exam. If I could just have you stretch your arm out for me. Perfect. And where did you say you were having that rash?
Kind of in this area, the middle area.
Got it. Okay. It does look like you have a little bit of scarring. I think maybe the hives or bumps you were having went away.
Okay.
Is it painful or?
No, it's not painful.
Are you currently experiencing any itchiness?
Not at the moment, no.
No. Okay. And how many days ago would you say that went away?
About 4 days ago.
4 days ago. Okay. So before we get started with the allergens, I'm going to do just a light cleaning of your arm. Is that okay?
That's fine.
Okay, so I've got some water here. And I'm going to use a gentle skin cleanser. This is Cetaphil. It's just a very mild cleanser. It has no sulfates and it's not going to irritate your skin. It's non-comedogenic, okay?
Okay.
I'm going to be using this Dead Sea sponge. It is a little bit abrasive. It's not going to hurt you, but it is going to exfoliate your skin a little bit. We want to make sure we're getting off any old product or dead skin cells before we get started with the test, okay?
Okay.
So go ahead and stretch your arm out for me. We're going to start with a little bit of water. Okay. Now a little bit of the cleanser. And I'll just get that exfoliated in. And we will be primarily working here on this area closer to your wrist.
Okay.
Let me know if I'm hurting you.
That's fine.
Now I'm just going to spray this off and we'll go ahead and wipe it. All right, I think we're good to go there. If I could just have you turn your wrist out a little bit, and we're gonna move your arm in a little closer so I can reach. There we go. Okay. Now, we're gonna use some cotton buds to apply the allergens today. These are biodegradable. To get started, I will be placing some double-sided tape on your arm. This is just going to act as a divider. We're going to create a little bit of a grid here to apply the allergens in, okay?
Okay. Go ahead and number these boxes. And we will match them to the corresponding allergen. Do you have any questions so far? No, I don't.
Alright, so today I think we are going to do the most common allergens that you would see in your area. Okay, so this is just a compilation of the things that you're going to see most frequently here in Pennsylvania, specifically in the city.
Okay.
We have some frankincense, sweet orange, lemongrass, tea tree, peppermint, rosemary, eucalyptus, and lavender, which is a big one this time of year. You're going to see a lot of lavender pollen, okay?
Okay.
So I'll go ahead and apply these one at a time. You might feel a little bit of discomfort if we have a positive reading from these, but they'll be taken off in just a few minutes, and don't worry.
All right.
Okay, so go ahead and stretch your arm out for me. We're starting off with the rosemary. And I'm just gonna dab that in the center. And then we will use a new Q-tip for every allergen so that we're not creating any cross-contamination, and that's why we use biodegradable Q-tips, so that we're not using too many at once. So our second allergen is sweet orange. Something you're going to come across more so in spring and summer.
Okay.
Third allergen is going to be lemongrass. Another spring and summer. Our fourth allergen is frankincense. This one tends to be a common allergy amongst people. It's more of a fall-winter allergen, I would say. You tend to see it more so in like grasslands or wooded areas. So if you ever go camping or anything like that, this would be something to look out for if we do find that you're allergic.
Okay.
Our fifth allergen is lavender. And this is a very common one that a lot of people don't realize they're actually allergic to. You'll find it in a lot of Bath and Body products, sometimes even in perfumes and cologne. The next one is tea tree. This is another one that's a pretty common allergen. You'll find this in a lot of soaps and facial washes, so you do want to just watch out for them. It can also be in some shampoo and conditioners. Our seventh allergen is peppermint. And this one is obviously more of something you would come in contact with while you're eating.
Okay.
Not quite as common, but some people do tend to be allergic. Okay, our last allergen of this set is eucalyptus. This one actually smells quite nice. kind of sneak up on you a little bit because it's a milder allergen, but it is known to cause rashes. Okay, for our last two, we have a histamine that is going to test positive, and this is the positive control.
Okay.
So we do want a reaction from this one just so we can make sure that the test is being reported accurately.
Okay.
And the 10th is a negative control. There should be no reaction from this one at all. Okay, so we're gonna let those sit for about 1.5 minutes, and we'll come back and double check to see what we have, okay?
All right.
Okay. All right, Julio, so it looks like it's been about 2 minutes there. I think we should be good to go. Just gonna grab what we like to call our adjutant. This is a chalk pinwheel roller. And all this is gonna do is slightly irritate the area so we can make sure it's fully penetrated, okay?
Okay.
So far, I'm just gonna have you move your arm up here. So far, I'm not seeing anything too bad. Are you feeling any kind of itchiness or burning?
No, I don't feel anything.
No? Okay. So our positive control is positive, which is great. I see a little bit of redness, a very tiny amount of swelling, which is what we're looking for. The negative control is negative. There's no reaction at all, so that's great. So with this, I'm just gonna go ahead and mark around the areas a little bit. We just wanna make sure we're really penetrating the skin here. And you can let me know if I'm hurting. And we will go ahead and reactivate that positive. And the negative control, obviously, we don't have to worry about. So while I let that sit, I'm just gonna get everything ready to clean your arm off. We'll give that about another 10 seconds. So we can go ahead and remove the tape now.
Okay.
And I'm actually not seeing very much reaction, which is really good news. It does look like we have a little bit of reaction to number 7, which was the peppermint.
Okay.
Interesting. Have you ever noticed an allergy to peppermint?
No, I can't say that I have.
Okay. So it is something to look out for. It doesn't look like any kind of anaphylaxis. It's a very mild allergy. It almost looks like hives.
Okay.
I'm wondering if maybe you used a soap that had peppermint oil in it. It could have been a body wash, even if it's maybe something you're used to using. Allergies can sometimes come about when we're not expecting it, even if it's something you've already been exposed to.
Okay.
So that's something to look out for. I wouldn't say that you need to avoid it entirely. I would be careful using it in concentrated forms, such as peppermint oils and essential oils, okay?
Okay.
Okay. The other ones all look negative. Very good, okay.
Okay.
So let me go ahead and get this off. I apologize if this is a little bit painful. just go ahead and get that wiped off for you. And this is a washable, non-toxic marker, so the rest of that will come off with a little bit of soap and water. Okay, there's a restroom down the hall on your way out.
Okay, thank you.
No problem. So, I am going to apply a little bit of lotion.
Okay.
I'm going to show you two options here. I'll only use one of them.
All right.
But I just want to show you that these are available and they're not going to be anything that's going to irritate your skin. I don't think you have eczema or psoriasis, but these are eczema and psoriasis safe, okay?
Okay.
So the first one is actually something that I use at home and I love it. It's Eucerin. It's for eczema prone skin. It is eczema relief cream, but it really is just a colloidal oatmeal lotion. So it's gonna help with any kind of itchiness, any dryness, especially if you tend to be prone to dry skin in the winter time.
Yeah.
So this will be good for you, okay? It has ceramides 3, which is great for your skin, and it is fragrance and steroid free, which is something we always want to look out for, okay?
Awesome.
The second one is by La Roche-Posay. This one is a little more expensive, but again, it's great for dry skin. You can use this one on body and face, where this one is just for the body, okay?
Okay.
Okay, so I'm also gonna apply some of this All Better essential oil. It doesn't contain peppermint, luckily, so you won't be allergic to it, okay?
All right.
I'm gonna mix this in with the lotion, and it's just gonna help soothe any of those areas that did become a little bit irritated from the allergens, okay?
Yes.
And this is a sample size, so this is something I will send home with you. It is very concentrated, so you only wanna use about 1 drop for every dime size amount of lotion.
Okay.
We're gonna use a very small amount of lotion, so we won't even use 1 full drop of the oil, okay?
All right.
So just keep that in mind when you use this at home. You want to use a very small amount. Okay. And like I said, this will just help tone down any of that irritation. We don't want you going home feeling itchy.
Thank you so much. Oh, it smells good.
It does smell very good, and it's actually naturally fragranced, no artificial fragrances. Something to keep an eye out for when you're buying any kind of body care products, lotions, body wash, face wash, especially because the face is sensitive.
Okay.
Laundry soap, dish soap, you don't want to buy anything that's artificially fragranced, okay? Okay, so we'll let that soak in a little bit, and I'll get a little care package together for you, and you can take everything home.
Okay, sounds good.
I'll let you hold on to that. Okay, Julio, I'm just gonna catch up on a couple notes here.
All
Give me
right.
just a second. So you did have an allergy, the very mild allergy to peppermint. And like I said, peppermint is an edible allergy, so just when you're going out to a restaurant or especially around Christmas time, people tend to put peppermint in candy, so it's something that you definitely want to look out for, okay?
Okay.
So I'm going to go ahead and write you a prescription for a couple things, and let me just show you what they are. And these are sample packs to hold you over until you can get those prescriptions filled, okay? This first one is just some Visine Drops. These are going to help if you're having any kind of I would say more severe reaction. You shouldn't necessarily need these on a day-to-day basis.
Okay.
I do want you to just be mindful overall when you're petting the cats. Anytime you've been handling them directly, if you ever happen to give them a bath or you're brushing their hair, you're definitely going to want to wash your hands with a mild soap and water.
Okay.
And avoid touching your eyes, nose, and mouth, okay?
Definitely.
Any of those mucous membrane areas, you don't want to transfer the cat dander because you're more likely to have an anaphylactic reaction, okay?
Okay.
So you can just apply these as needed. They're gonna help with any itchiness, dryness. They're not just used for the allergies if for whatever reason your eyes are itchy or dry. Sometimes seasonal allergies can kick in unexpectedly. So that would be a good time to use these as well, okay? And it's about 1 to 2 drops in each eye. So I'll let you take those home as well.
Okay.
Next thing I'd like to talk about is this Mucinex nasal spray.
Okay.
This is very satisfying. You spray it 1 to 2 times in each nostril. You only want to use this once every 12 hours, so it is a twice-a-day medication.
Okay.
So you just squeeze the top here. Looks like this. There's a
Alright.
very small hole at the top. You're going to insert this into each nostril all the way to the base. Hold it with your 2 fingers and gently push down as you inhale all the way in, okay? You don't want to inhale so much so that you feel it going down your nasal passage, but you do want to inhale enough to where you feel it go up to the bridge of your nose. Okay? So just remember once every 12 hours for that one.
Okay.
And that's going to help with any kind of congestion. This chloroseptic spray is going to be really good to help you with those coughing fits that you said you've been having.
Good.
This is fast acting. And it works in about 3 seconds. I'm not kidding. It works very, very quickly.
Okay.
Don't be alarmed the first couple times if you use it, if you feel a little weird. If you've ever gone to the dentist and they put the numbing cream around your gums, it kind of feels like that, but in the back of your throat. But it does immediately help alleviate the coughing, okay?
Right.
This is cherry flavor. Is that okay?
That's fine.
Okay, when you fill your prescription, you can let the pharmacist know
Okay.
what your preference in flavor is.
Okay.
Okay, and this is 1 to 3 sprays, and you can use this every 2 hours as needed, okay?
All right.
We'll send you home with that one. Next is a topical ointment. This is cortisone cream, and this one is extra strength. And this is going to be a 1% hydrocortisone cream. It's going to help with any itchiness, those hives that you said you were experiencing. This isn't something I would recommend applying every day. It's not a lotion.
Right.
But if you ever have the rash reappear, you're going to want to apply this in that area after you wash with mild soap and water. Always wash the skin first, okay? A little goes a long way with that one. Lastly, I'm sending you home with the sample pack of loratadine. This is just going to hold you over until you can get your prescription filled. This is a mild allergy medication. It's an antihistamine. It's going to help if you're having any kind of immediate reaction.
Okay.
It's not the same as an EpiPen. This isn't for emergencies. It's just if you're having a little bit of a sinus reaction or you're having more of a coughing fit and the chloroseptic spray isn't helping right away. So this is something that you can go ahead and take. It is non-drowsy, okay?
Okay, thank you.
I am writing you a prescription for both drowsy and non-drowsy, just in case you need to take it at night.
Thank you.
No problem. So we'll send you home with that.
Thank you.
And I will go ahead and send your prescription over to the receptionist. Once you meet up with her, she will give you a little bag to take your goodies with you.
Okay, thank you.
Did you have any questions for me?
No, I don't think so. You answered everything. It was very thorough.
Perfect. Well, thank you so much, Julio. It was very nice to meet you, and we look forward to having you back in the office. If you have any questions, you can call us or get on the patient portal, and we'll chat with you there, okay?
Thank you so much.
Thank you so much. Have a nice day.
You too.